Welcome back, everybody. Barry, thank you so much to be here. From the first time that I met you, I want to have this discussion so much. I'm really happy to have you here as a guest in my podcast. There is so much to talk about it, and I can't wait. This is a very serious and important topic for everybody. Is our life, our health, is the precious time that we have in this planet. So we need to do the best that we can. First of all, if you can introduce yourself and tell to the audience who are you and what you do.
All right. Well, thank you for having me here, Leo. First off, my name's Barry Clanton. I'm a physician assistant from Precision Medical, Urgent Care and Family Practice, and Precision Medical Pain Management and Orthopedics. And so my wife and I own that business, and we are here in Utah, in Utah County, but we have 5 clinic locations. We're in Spanish Fork, Provo, Pleasant Grove, West Valley, and Murray. So we're in Utah County and up in Salt Lake County. And my background is I'm a physician assistant, as I said. I graduated in 1999 from St. Louis University Medical School, and I started work in orthopedic surgery. I have a background in physical therapy. I used to work in physical therapy prior to going back to PA school. I did that for about 7 years. And I knew I wanted to do more. I loved physical therapy, but I definitely wanted to do more and learn more of medicine. And I loved orthopedic surgery. So my objective was to go become an orthopedic surgeon. But I was married and had 2 young boys at that time, and realized the length of time involved with that training and how long it would be, and I just really didn't want to sacrifice those years with my boys, my young boys. And during that time, I just was trying to figure out more of the path I wanted to go, and I didn't even know what a PA was, but I eventually learned what a PA was, and I realized that was actually a pretty good track for me because of the time commitment of what it would take in school, and the amount of money, student loans that you have to pay back. Med school is extremely expensive, and these days most doctors are coming out of school at $250,000, $300,000 in debt. So this was a more fast track to become a PA, and so I decided to go that route. And so I applied to school, and I got accepted to St. Louis University, and the rest is history, as they say, right? But when I came out of school, my first job, I went into orthopedic surgery, and so I was still able to go do ortho anyway, but I was the other guy on the other side of the table. So, for most surgeries, it's a 2-man job, so it depends on the depth and complexity of the surgery, but the surgeon would be on one side of the table, and I would be on the other side of the table as the first assist to the surgeon. And I personally have been involved in thousands of surgeries, so that was good. I learned a ton about orthopedics in the years that I worked, and I also had other experiences. I worked in emergency medicine as well. I worked in the ER for a while, doing more complex emergency room cases. And of course, in the ER, they loved it when I worked because I was the orthopedic guy. So when orthopedic problems came into the ER, they were always saying, "Barry, we need you to help with this case. Come look at this." The doctor's there. Because a lot of the ER doctors, of course, they know a lot about the first steps in orthopedics, but they don't know the extension all the way through, right? So when I was there, it was a good team approach. So that was good for me. I did a lot of work in internal medicine and general medicine, also urgent care. I'm originally from Florida, and I lived there for many years, and I'm a 30-year lifelong surfer. I've surfed all my life, so the ocean is life for me. And it's funny because patients will always ask me, "You're from Florida? Well, what are you doing here?" And then the real answer is only a woman has that power. So my wife, who's here with us today, Amanda, she pulled me out of the water. And so here I am.
Barry, when did you realize that there was something a little bit wrong in the healthcare system today?
Well, that's a great question. And that didn't take long. Once I got into working in medicine, in physical therapy, of course, we were still working in medicine, but a different side of the table. But when I became a PA and started into really taking care of patients from a medical standpoint more comprehensively, I saw very quickly that we have a problem across the table in our system. And the primary concern is being able to afford medical treatment. And that patients many times just go without because they have no resources to be able to access care. And so that's always been an issue ever since I've been in medicine. So I've been a PA for 26 years, and from the time I was a student in school, I saw that problem. And, now we've been trying to think outside of the box and come with some solutions that can try to help and get back to the roots of really taking care of patients, and then ultimately trying to figure out how do we get them access to care because of the costs going higher and higher every year.
When we say bring back the common sense, to this problematic, what do you think we really mean?
Well, I think the real issue here, and what we've seen so much as the years have gone on, is that it's been worse access for patients, primarily over expenses like we talked about. But because of that, doctors are being squeezed harder and harder, both in being able to build and have a successful practice because of how much it costs. I mean, the overhead expenses for medical practice are huge. To provide care for people and have the staff, nurses and medical assistants and front desk, and to hire good doctors to be in the clinic, and then pay for malpractice insurance, all the medical supply costs, and then have shrinking reimbursement coming from the insurance companies. For an example, Precision Medical's been in position for 12 years. We've never had an increase in the reimbursement from insurance rates. Never. So the reality is, the shrinking continues as far as how much things cost and then how much reimbursement costs. We always talk about cost of living raises and inflation going higher, but what about the doctor's reimbursement, right? It becomes increasingly more difficult to be able to sustain a clinic and to be there to actually provide care for these patients. The other thing, too, is because of that squeezing of the dollar in healthcare, it makes the doctor's ability to truly manage patients harder and harder because of the resources that the patient has to be able to access when we need diagnostics, when we need laboratory work, when we need diagnostic imaging, things like that. It's expensive. So it's difficult for them to have the resources to do it. And then the other side is, because of that, it also pushes the doctors to have to see more and more patients in a clinic, which shortens the amount of time with a patient and really makes it more difficult to address all their needs. And so, some of these bigger companies that are around, they're seeing patients every 10 minutes,
Wow.
every 10 and 15 minutes. And so if a clinic is packed with one provider seeing 25 to 30 patients in a day, it makes it very difficult to give that patient the quality of attention that they need and really take the time to figure out their diagnoses and make a good plan of treatment and convey that information to the patient in such a timely way, because patients don't know what to do, and they're there for the expertise of the doctors, and there needs to be time allotted to actually convey that information to people. And if you're just squeezed and needing to see more and more patients just so you can keep your doors open and survive and pay your staff, it's a recipe for disaster for the consumer and for patient care as a whole.
1,000%. We always think that the healthcare system is so focused in prescription because it's so money driving. Why do we have this feeling?
Well, as I was just explaining about all the financial concern and the constraints, it's way easier to give somebody a prescription, give a patient a prescription and say, here you go, this is what you need, carry on, than it is to actually educate them, take the time to give them the information necessary, and then allow them an opportunity to make changes for themselves. Because the patients, they come and they respect the doctors, they're looking for guidance, and they say, well, if the doctor gave me this prescription, that's must be exactly what I need to do, right? Well, that's not always the case. I mean, many times prescriptions are not the answers. And so for me, I always try to really dial into more specifically the deeper areas of the problem. But what's most important is to educate our patients so that if someone understands what's going on and they really understand their problem, then they're interested in the treatment. It makes sense. They buy off on the treatment because they're committed then, because they have a better understanding of what they really need to do, instead of just coming in and seeing the doctor and the doctor says, okay, yes, I already know your problem. Here it is. Here's some prescriptions. This is what you need to do. Just trust me. Go take this prescription and you're going to be fine. Well, that's not really the case. And for me, many times giving patients prescriptions is putting a Band-Aid over the real problem. And we're not interested in Band-Aids. We're interested in cures. We're interested in moving the needle for these folks to improve their quality of life and longevity of life. And, I can't tell you how many times I see people that are just destroyed medically, and they have no idea what to do. Mm-hmm. And I think it's interesting because I'll tell patients this sometimes. I say, you know what a Polynesian diet will do to you? It'll turn you diabetic. You know what a Latino diet will do? It'll turn you diabetic. And you know what an American diet will do? It will turn you diabetic, along with high blood pressure, high cholesterol, low testosterone, because again, that's a whole nother subject, but low testosterone in our country is an epidemic, and it's not just for men, but also for women.
Wow.
And that affects so many things across the board. Mm-hmm. But again, we have an obesity crisis in our clinic, and the more percent body fat you have on your body instead of lean muscle mass, the lower your testosterone goes. Mm-hmm. And that really translates into multiple other problems, right? And so, the issue here is about education. It's mm-hmm. about being able to help people really understand what's going on with their lives. And unfortunately, we're battling a cultural problem as well, because the culture of our society is food, sugar, carbohydrates, lack of exercise,
big portions,
more screen time. As we have turned to a life of more ease, we've also increased the complexity of medical problems going mm-hmm. forward. And, most people don't want a yard anymore. They don't want to work. They don't mm-hmm. want to go outside and cut the grass and mm-hmm. trim the hedges and rake and do all the things that it takes. And so they'd rather live in a condo and have no responsibility outdoors, which means they have more screen time, right? Mm-hmm. Watching Netflix, Amazon Prime, on the internet all day, on their phones. Unfortunately, it's an epidemic, and it's leading us to be sicker and sicker. And if we don't do something about that now, we're going to be in worse trouble as the years go by with our children, because even our children, I can't tell you how many times we see obese children in the mm-hmm. clinic, like obese. And I find out what's going on. What do you do for activity? And they do nothing. Wow. They're on their phone and watching TV all day. They go to school, and luckily in school, they at least try to push them to have some physical education, but it's minimal. And then, they get a little tiny bit there, and they come home and they don't do anything. So we need our kids active. We need our kids running around and playing ball and, riding their bikes and mm-hmm. playing with their friends in the neighborhood, the good life that we experienced as children growing up, probably you and I both, mm-hmm. Leo, is harder and harder to find, mm-hmm. Especially as we're becoming more of an urban society. The more urban we are, the less activity really is there. Mm-hmm. And so people that are living more rural, they're still having fun, getting out there, digging in the dirt and doing things, So that's a problem.
Absolutely. And I have a side question that is incredible, because you will think so many informations now, they are so easy to get from internet. Mm-hmm. So do you think that this new generation are less into the prescription, or is always the same, or in the past was worst? What do you think?
That's another really good question. And what I say is, and unfortunately I'm not trying to be offensive or rude, But in our society as a whole, people don't want to work. They don't want to work hard. And so many people come looking for the quick fix, right? Just give me that pill. When they have hypertension, for an example, if someone comes in and they have high blood pressure and they're tachycardic, which means their heart rate is high, I look at that and I say, okay, this is not good. And we don't just treat with blood pressure off of a singular read. We need to see consistently that it's high. So usually I'll recommend that they go home and buy a blood pressure cuff so that they can determine for themselves on a more regular basis what their blood pressure has been. I'll have them record that data, then come back to me and we'll talk about it. But almost everybody drinks caffeine. Mm-hmm. And so caffeine is a potent vasoconstrictor, rather. And so if you drink a drink that causes constriction of your blood vessels, it's going to increase your blood pressure because your heart is having to pump against resistance as it's trying to pump blood out into the periphery, but it's also a stimulant, so it increases your heart rate, right? So when I talk to someone about these basics, just simply avoiding caffeine, they're like, oh, no, I couldn't do that. There's no way. I need my caffeine. And I'm like, well, if you need your caffeine, then we're going to have a couple of blood pressure pills to go along with that, right? But they say, oh, but I don't want to take blood pressure pills. And I'm like, okay, well, if you don't want to take blood pressure pills, then you need to really seriously think about stopping to drink caffeine.
1 + 1 is only 2.
Right.
Nothing
and
else.
So instead of saying, no, some people literally will just say, just give me the pill. I'm not going to stop my caffeine. Wow. So, I respect their choice. I always respect their choice because our job as clinicians is to educate them and give them all the data, and then ultimately we respect their decision as long as it's an informed consent, right? And so that's the issue. And so that's just one example of many that I could give. But the problem is that our society as a whole today, as everyone is living a little bit more rapid-paced life, that's why they're eating more fast food and things like that, because it takes effort. It takes energy. It takes time to go to the grocery store and to plan a menu and to actually buy good foods and then go home and cook them and then have to clean the kitchen, right? So everybody wants the quick move. And, as they're on that fast pace of life, it comes at a cost, unfortunately.
1,000%. Do you think the last generation are better to understand that there is not a quick fix and just to use, prescription, or not necessarily? Do you think we're getting better though? Like the youngest the people they are, the more they are aware that prescription is not the solution? Is that old-fashioned or not necessarily?
No,
actually?
I don't think so at all. I think as the younger generation is wanting the medication more.
Wow.
And so, unfortunately for us,
I'm surprised.
when we come and we deal with them, then we are really trying to educate because they're not getting the best education from schools today about health issues, about diet, about exercise. Some do. I mean,
even if they are 24 hours in the phone, they're not searching the right things.
They're not searching. They're on Facebook. They're not hunting. Although Facebook has a lot of good information.
That's right, but a lot of wrong too.
And yeah, there's a lot of bad and good. So I'm always on Facebook looking at stuff, about medical issues, and there's some good data there, right?
But this is a surprise for me. You don't think that the new generations are more aware of prescription is not an easy, fix than the old generations? I will bet for the new generation to be more, in front of the problem. They know, they have the data, they have the reviews. They do
have the data, and there is a lot of good information out there, and so you can gain anything off the internet now. And with ChatGPT, it's crazy. I mean, there's so much information. If you want to know, you can find.
Yeah, but that doesn't translate for you to the patient. Wow.
It does not translate mostly into their lifestyles, and I think a lot of it is just like I'm saying, it's just the fast pace of our world these days. It's rocking and rolling, and people aren't stopping to pause to take care of themselves. They're just pushing, especially as everything has gotten so expensive. People are having to work harder and longer hours, so it really crunches their time to even think about exercise. And this is something I always tell the patients. I say, look, the reality here is there is no convenient time to exercise. There never is. You have to force it into your schedule if you want to make that a priority. And that really applies to anything of value, right? If you want to succeed with something, you have to prioritize the time and force it into your schedule to give yourself ample time to do what you need to do. And unfortunately, we're just seeing less and less of that as our rapid pace continues.
How do you think the relationship between insurance companies, doctors, and pharmaceutical companies influence the outcome of the people?
Well, we've talked a little bit about that, but pertaining to the insurance companies, the problem is they're just really not wanting to pay for much. So even when people get insurance, they still have big deductibles mostly these days, and so a lot of folks are still scared to come to the doctor or unwilling to come, even if they have insurance, because they're worried about their deductible. So for an example, my wife and I were just looking at changing plans. We've been on a grandfathered plan for a long time. It's been $900 a month for us, for my family, which is just my wife and I and 2 children now in our home. And we just got notice that plan's being canceled. And we don't even have any claims. We've never had claims.
Wow.
So they're canceling it because it's too cheap. So now for me to look at the marketplace and determine a plan for our family, it's $2,300 a month with a $9,000 deductible. So for your common folks that are just trying to make sense of that, no one goes to the doctor because they can't afford the $2,300 a month. Or even if their employer pays and says we're going to offer, many times the employee still has to pay half, or they won't cover their families, or they'll have to add their dependents or whatever. So it's still expensive. It's still expensive even for the half that the employees would have to pay. So many times they opt out and they go uninsured. Or even if they have the insurance, they're scared because of the deductible cost. Mm-hmm. And the real facts are they need to be scared to some degree, because depends on who you see as a doctor. Many times the doctors are going to just order all kinds of testing and labs and diagnostics when maybe it wasn't critically necessary. And instead of using a stepwise approach of a proper algorithm of treatment, they just go for it and just order all these tests, which then translate into big expenses for these families. And that only takes once or twice to get burned like that before they're scared to go to the doctor, right? So from the insurance company side, it's about restricting care, squeezing costs, and making it hard for patients to come. The fast-paced side of that is, like I said, it's easier to take prescriptions than it is to truly get to the bottom of the problem and try to correct the problems and make a significant change that leads to a cure rather than putting Band-Aids on problems. And so that combination is a recipe for poor healthcare. And so from our perspective, we need to come with some better solutions on accessibility of cost so that we can really get to the bottom of the problems and give patients the education that they need. And hopefully, if they get educated well, then they'll decide to take action, right? And so that's some of the combination between it. So as far as insurance companies and pharmaceuticals, they're making tons of money. And so unfortunately, it still boils down to money. The balance between actually handling the healthcare needs for these folks, but also allowing everybody to win around the table. When we personally make any level of a business transaction, I want every single person that touches that transaction to win. It needs to make sense for everyone. When it comes to patient care, the making sense to the patient is meaning that they have adequate access to care and they get the time with the doctors needed to be able to, move the needle and make change for themselves. Yeah. So it's a balancing act.
Do you think with the time the price for people went up for the insurance, for premium and how much they pay?
Oh, for sure. Yeah, the premiums are going up and up. I mean, like I said, we just are going from $900 a month for my own family to $2,300. That's a $1,400 a month increase with zero claims on our against our insurance.
Why do you think this happened and he will continue to happen?
I think it's a lot of things. I mean, it's inflation, right? The cost of goods, the cost of salaries. I mean, everyone's needing to make more money in order to cover the increased cost of supplies for individuals and families, but medical supply is the same, But of course, if fuel costs go up, then it translates across the board that the supply chain is going to be more expensive because it's taking more money to move those supplies. So
and
that's another real problem.
And maybe the whole machine of insurance company become more expensive. They all agglomerate all together.
Well, because of that, what happens is, of course, there's more charges for healthcare because it takes more money to take care of patients. So if someone goes in-house to go into the hospital, it's extremely expensive. I mean, going to the ER is a ton of money. And so, especially when you have someone that's marginal, that's on the line, either with no insurance or they have a high deductible plan, they're going to burn their deductible when they go in the ER. So, they're nervous about that. Mm-hmm. So, but the cost of taking care of patients is rising. And, it translates across the board, just like it's the same with building a house these days, right? The cost of materials are so expensive. I have many friends that are in construction, and they're saying the cost of building now is just astronomical. And again, it translates across the table with all these things.
Yeah. Have you ever felt directly or indirectly to cure the chart rather than the human being?
Well, I think, indirectly you kind of have to make moves on the data that's there, right? And so, that's a pressure that we all feel as clinicians because we're trying to give the patient what they need information-wise and the time that they need, but we've got a full waiting room and there's people waiting to be seen, and you don't want to keep people frustrated because it's taking too long. So you have to balance the economic side of medicine versus true patient care. And unfortunately, sometimes that's how it goes, is that you're looking at the patient's chart and you're reviewing their stuff, and with really getting down deep into their issues with a real interview with the patient, it's a natural tendency for a clinician to just move fast and leave the questions behind, right? Or the information behind, which is really poor medicine.
What do you think you and Precision Medical do different from other clinics around?
Well, our main thing is when someone comes in to see us, I want to know everything about that patient. I'm not prying into their life, but I am trying to get a finger on the pulse of their resources and what kind of stressors they have. So we really take the time to get to know our people. So when they come in, I want to know, are you married? Are you divorced? Do you have children? How many? How old are they? What's your family scenario, extended family like? Do you have family around here? What do you do for work? Are you unemployed? Are you underemployed? Are you adequately employed? Are you providing financially enough for your family? Or are you struggling? Do you have insurance or no insurance? Are you working out? Are you eating healthy? Are you doing drugs? Are you drinking alcohol? How's your relationship with your spouse? How's your relationship with your children? Mm-hmm. I mean, it's not that I'm trying to pry into their world, but as a doctor, as a clinician, as a PA, I'm trying to really understand where they are in their life mm-hmm. and what are the stressors that are, getting a hold of them. And I can tell you right now, people are literally coming apart at the seams. Mm-hmm. I mean, anxiety and depression and insomnia is running rampant. People are turning more to substances to get a reprieve, so they're struggling there. So, I mean, we need to really understand their scenario. And then the next thing that we do is we want to get a good baseline of blood work so that we check everything. I'm checking for leukemia, for high white blood cell count, for anemia. I'm looking at their iron for women. I want to check the thyroid panel. I want to see their cholesterol, check for diabetes. I want to see all their hormones. We check some key vitamins to see what's there. So we try to get a good baseline of their medical stuff on the lab so we can see if there's any metabolic issues going on. And then we take that whole formulation of things and then we start trying to put together a plan that's going to help them improve. And if they've got abnormalities in their labs, which almost everyone does, mm-hmm. then, unfortunately, we're trying to combat that as much as we can from a natural standpoint first before we look to medications. But we do a lot of functional medicine in our office as well. And so functional medicine is really a deeper way of doing medicine. That's where we're trying to really get to the root causes. So that's why we check blood and all the things that we're doing. And we are focusing a lot on their diets and exercise because really that's what it boils down to for most folks is diet and exercise. And that can solve so many problems. So when we're seeing a patient, we're really trying to step back and get a good comprehensive history, do a solid physical exam, utilize diagnostics as needed to really put together a more comprehensive plan of attack going forward to help them improve.
This is a personal question. I'm very curious about it. Why so often women are low in iron? I saw this before.
Well,
compared to men.
Well, the reason for that is because of menstruation, right? So when they're having their menstruation and they're bleeding, then they're losing blood, and that can force them to become anemic, but it also loses iron. And so that's a real key one, because when a woman comes in and she's complaining of fatigue and just burned out and tired, I want to definitely look at a complete blood count, so I make sure they're not anemic. We're looking at their iron panel, because if they're low in their if their hemoglobin, which is how we measure blood volume, if their hemoglobin and hematocrit is low, many times their iron is low. And so if we treat the iron helps to produce blood, and so then they can move the anemia into a safer position and they're not anemic. So we always check iron in a female. And then, of course, we always want to balance the hormones as well. And then, of course, we check thyroid. So if someone is fatigued, then we've got to check all those things. And with a male, you wouldn't expect to have anemia unless there's a problem, because there shouldn't be any blood loss.
Of course.
If there is blood loss, the first thing we want to look at is a GI source, or maybe they need a colonoscopy, or we at least do guaiac stools, where we check to see is there blood in their stools or any type of reason. Is there a blood loss somewhere? Because if you're anemic, most of the time it's a blood loss, right? Unless they're very sick with renal issues and other problems, and then we call it an anemia of chronic disease, which is another pathway of problems. But these are general screenings that we do when we're trying to really find out what's going on with someone, especially when they come in with fatigue.
How much is important the education for the patients to understand their status, and why this common sense, if you want to say, is not general for all the doctors?
Well, I think it is general for all the doctors. The question is, are they actually doing something about it, right? Many times, there's loads of brilliant, awesome doctors, right? And I think everyone that goes through medical training and goes through medical school, they're knowledgeable, right? Because you have to study a ton and you have to pass boards and do all these things to get to the position where you are. So most of the time, it's never really about lack of knowledge, as it is more about lack of follow through, dropping the ball on different issues, and being tired and not getting deep like they need to with people. But the reality there is the education.
Or there is no interest for some people.
Yeah, or there's no interest because they're just tired and burned out. But I will tell you that education is everything. It's what it's all about, because as one of the things that we do in our office, besides for all the general medicine, is we're also specialists in orthopedic management of injuries. And so, we do a lot of personal injury cases with people getting injured in automobile accident. We stand in the position of the forefront of that case in order to be able to really define the problems and figure out what is the best plan of attack for them through solid physical exams, but then also understanding diagnostically what we need to do for them. And then what we do is stand as the quarterback in those cases to delineate the pathway of treatment, whether we integrate with physical therapy or chiropractic care, or if they need to see the orthopedic surgeon based on imaging that we get. And so when we take a patient that comes in that's been injured and they have real problems, every single time I see a patient, I pull out the Netter's anatomy book, which is the one that we studied when we went to med school, right? It's a super great anatomy book. And I show them in total detail, this is what your normal anatomy is, this is what happened to you in this accident, and this is the injury that you've sustained, and this is why it's there. And now here are the problems. Now this is the whole plan about what we need to do to improve you and where to go with this, and this is the type of treatment that you need, the medications that you need, if they need injections or other problems, or other therapeutic things, and we recommend these things for them based individually on their specific problems. But if we don't pull open the anatomy book and explain it to them in great detail, then they're still lost, and they say, well, why am I doing this? So for me, the anatomy book is key in those injuries, because a picture says 1,000 words, right? So if I can explain it to them and they can see it with their own eyes, the problems that are there, then they're happy to perform the treatment because they know that's why we're ordering things, and they're more willing to put in the time and the effort and energy needed to follow through with their treatment. And then once that occurs, we bring them back, and then we see them again, and we see how they're progressing. So we continually are having our finger on the pulse of these folks and then making the necessary moves based on the response of treatment. But if they're not educated about it, then they never buy off on the treatment plan. So it's a moot point almost.
Do you have any specific example of a patient that you changed his life because you were focused on the prevention rather than just a prescription? Do you remember any?
Well, yeah, that's I have several, but there's one right now that comes to mind. This fellow, he was injured badly in an automobile accident, and he came to me down the road after his case was like 2 or 3 years old, and he came to me just on high-level narcotics. Okay, that was not prescribed by me, but he came to me on high-level narcotics, and he really had nothing else going on in the way of treatment. And he's like, "Can you take over my prescriptions?" And I was like, "No, I don't think I can do that. But if you want to change your life, then I'll help you do that," right? And so from there, so you have to understand something when it comes to pain. This is a very important point, actually. We don't really treat the pain that much, okay?
1000%.
We do indirectly, but what I'm treating is function. I'm treating someone's functionality. I want to see them pushing forward in their life and getting back to all the things that they want to do and need to do to put food on the table for their families, whether it's in their employment or if they want to go skiing or go hiking or, go play ball with their children or whatever their situation is. We need to really understand their functionality. So with this particular guy, I was telling him, I want to treat your function, not your pain. And of course, he didn't like that. He wanted his pain medicine. And I said, I'll give you some pain medicine, but under some conditions, right? And so with this fellow, I got him back in the gym. He's working out. He's doing everything he wants to do, where he was debilitated when he came. He's riding, he was from California. He went back over, saw his children. He's had some problems there with that, but just some estrangement, but we helped and counseled and worked and, got some really good changes with even things going on with the family. But then he goes back and goes and rides jet skis out in the ocean, and he's jumping waves. And when he comes back to me, he was so excited and happy because he was going back to do the things that he loved. He's doing everything he wants to do. He's working on his car. He's a classic car guy. He's like restoring vehicles. He's hiking with his dog on a daily basis. He's going to the gym regular, whereas before he came to see me, he was doing none of that. And he just wanted pain pills, So I think that's really the key, is just loving encouragement with the right type of education and the right treatment plan will really change lives. And so for us, that's our mission at Precision Medical, is to change lives going forward in every way, even spiritually. I mean, because the spirit and the physical are coincided, and so when people have no relationship with God, then that's a problem. And for me it is, because he's the great physician, right? And so if we can help them to just really bring things back into the right perspective, and then push themselves physically to improve, then we're changing lives.
And do you think that this can be a movement, as a revolution, to touch more the prevention rather than the prescription? It can start and sprout, and because it's also common sense. Do you see this growing in the future? What do you think?
Oh, absolutely. Well, I think what has to happen is we have to have like-minded physicians and clinicians, nurse practitioners and PAs and physical therapists and chiropractors and everyone that gets in front of the patients and nurses, everyone. And we have to have like-minded people that are fighting for the same cause. And I think if we can get back to some of the roots of why we went to medical training in the first place, which was to help people. I mean, we all, of course, want to we have to work doing something to make a living for our families. So we all, of course, want to work and make money, but you can make money doing a lot of different things. Dealing with patient care is not easy, and it's not nearly as easy as people think, and doctors don't make near the money that people think. So you don't get into medicine because of money. You get into medicine because you want to help people. And I think that what we need to do as a whole, as a society, is we need to figure out better solutions of payment so that we can give these folks access and then get more to root causes of the problems rather than just treating their symptoms.
Absolutely.
And so that's really our slogan in our practices. Right on the front of our brochure, it says, treating the cause rather than chasing the symptoms. And, that's such a simple, one-line statement, but it transcends so many things, because that's what we need to do as a society in medicine. And I think as more doctors and clinicians get back to the roots of why they went to medical training in the first place, and then it is a grassroots movement, because we have to really try to improve the access and the quality of the care that's being given so that patients progress.
Yeah. And if you can redesign from scratch the healthcare system, what you will change?
That's a great question. And, after being involved in this for 30 years, I think the real answer to that is a hybrid approach. We need a hybrid approach. We absolutely have to have medical insurance. We have to have it in the case of major problems, cancers or strokes or heart attacks or severe accident or injury, severe illness, things that are unforeseen, because I've seen a lot of patients go bankrupt over medical bills. And,
wow.
It's a risk. Incredible. It's a risk to go without health insurance. And people get casual about that because they think, I haven't used my insurance in so long. I'm paying all this money every month, but I don't even use it. You need it. You need it for that unforeseen circumstance that will absolutely devastate you financially. And so we need health insurance, but we also need to get more responsible about bringing the costs down. The costs have to come down. And whether we do that through negotiation, through increased, competition so that the prices are working to come down, or we negotiate by self-pay rates or direct access to care so that we can give people better opportunity. I think the clinicians that are going to be involved in taking care of patients have to also really understand the community resources that are out there for them, because there are a lot of resources that are available. We don't really learn a lot about that when we're in medical training. You have social workers that get more involved in the resources of the community, but any good clinician knows resources, because you have people coming from all walks of life into the clinic, and you really need to know how to guide them when it comes to expenses and how to control costs. And so I think if we can formulate a better hybrid of mix of pay and mix of access to care, whether it's through self-pay discounted rates that are negotiated down, or direct access through different membership plan models and things like that, and also having health insurance, and then trying to let the clinicians or the doctors get into a position of more ability to make proper decisions on the treatment rather than the insurance company dictating the care based on cost. And I think that's the problem, and I think that we can do something about it. And I think that if we design a system that comes from that, and then of course also we have to control pharmaceutical costs. So we're very particular at Precision Medical about spending your money like I would spend my own, because that's what you have to do. And so even with medications, it's the same. You can write the latest brand names that are very expensive, or you can write similar same class of medications that are now generic, and you can save a lot of money. There's GoodRx out there and other platforms that you can have a significant savings on medications, but you need a good clinician at the helm that understands how to navigate those things and how to save cost based on prescription writing styles and their algorithm of how they function, right? Because you can blow a ton of money from prescriptions. So I think if we can get all three of those components lined up better, regular full health insurance, a direct care access or some type of self-pay system, combined with controlling pharmaceutical costs, then we're going to have the best chance of success.
And if you have one advice or more for one person to take care about their healthcare system, because a lot of people, will think that is for granted. A lot of other people will have no idea. What are like some generic advice that you can give to a person?
That's another good question. You have great questions, Leo. So really, quite honestly, for me, the best thing, and I always tell the patients this, movement is medicine. Absolutely. Be actively engaged and being active all the time. And, mix it up. Do the things that you like. So that's one of the things I always ask the patients. Like I said, besides for all those questions, I said, what turns you on? What do you enjoy outside of your work? What do you like to do, right? And then from there, you try to find a way to help pull that into some level of an exercise program, whether it's going to the gym or whether it's, working in your yard and cutting grass and weed eating and raking and, all those things, go for runs, go for bike rides, play basketball, play soccer, go for a swim, play tennis, play pickleball. Everybody's playing pickleball. Pickleball's awesome. I mean, it's a really good thing because, you don't have to be as high level as you do to try to play tennis, because tennis, you're chasing that ball. Pickleball, you can get to the ball, right? So, I mean, it's a really good thing. And I think if we can get people exercising, that's going to make a huge difference. But along with the exercise, then comes the diet. And that's where getting labs and understanding your baseline of where you are is critically important. But if we can educate people about both exercise and also better diet management, then we're on the right track. Ultimately, the choice is up to them, right? And we want to encourage them to do good, but the two big things is diet and exercise. If we can educate and help people change their ways, which is difficult, especially when it's cultural, right? Because it's just the way it was. I will tell you this, many times I'll have families say when we ask for family history of medical care, I say, so tell me about your family. Oh, did your parents have diabetes or any siblings, or and are they obese? What was their issue? Well, the reality is we are genetically predisposed to be our parents, but we're not them. We have a choice to make. And the reality is most of the time they may have had diabetes, not because it's a genetic predisposition, but because the lifestyle that they were living pushed them to be diabetic, which then, of course, is passed generationally down to the children and then the grandchildren. And if you're eating pizza and burgers and fries and, stuff and drinking Coke all day and eating ice cream at night and that's your way of life, well, guess what? You've got a problem. Right. And that's more cultural than it is genetic. And so I think those would be the 2 points, diet and exercise. And our role is to guide those processes. And then we also have all kinds of connections in the gyms and with trainers and physical therapy and chiropractic. So we have all the access of what we need for people. We just have to have them buy into their own progression and their own treatment plan. And if we can do that with them, we're going to really make a difference.
I love it. How people can join your idea or your movement, doctors or anybody, how they can help?
Well, I think we need to have better collaboration amongst clinicians, right? Better communication between offices. And, for us, I mean, the best thing to do is come and just make an appointment at Precision and get your annual physical done, because especially if you have health insurance, you're entitled to an annual physical screening test each year. And that's where we have the opportunity to check the blood and talk to them about all their health concerns and their issues and give education. So I think a first step is just to get your screening done, whether it's with us or any other office. If you have a doctor that you're seeing already, then schedule a time and go get your annual physical done and let them, talk to you about all your concerns and check your blood so they can see where you're at metabolically, and then, hopefully make a plan going forward. So I think from our standpoint, we're more than happy to see anybody for any reason. And if we are not able to handle what they have in their problems, which we can handle 90% of what comes through the door. But if they need specialty care, then we have all kinds of connections with the right specialists: cardiology, nephrology, endocrinologist, spine surgeons, general orthopedic surgeons, general surgeons. We have them all. We have everybody connected. And so we already have that level of relationship to where we're able to truly navigate the healthcare system depending on the needs. But that's exactly what needs to happen. Instead of doctors being isolated and feeling like they're their own island, we've got to get more community oriented. And, there's plenty of work to go around. So my feeling is we don't have to, take all the patients that we can get. I mean, the reality is you got to do what's right for people. And we may not be the right fit for you, but I think we are. But, that's our opinion, of course. But if we are not, we have all the right connections to move people to where they need to be and get the specialty care that they need as well. And I think that's really the key is a more synergistic and collaborative, ability to work together with different clinicians for different reasons, depending on what the needs are of the patients.
If you can save the world, this is the last question, right? If you can save the world one patient per time, what will be the message that you will give if you can talk to all of them, all the human race? What is the message that you will give?
I would say get serious about taking care of yourself, right? And many times, especially fathers, I know for me, I'll stand in the rain, in the cold. I'll eat peanut butter and jelly every day and eat ramen noodles. I don't care, as long as my wife and children are taken care of, right? But the real reality is it's a family approach. And that husband also needs to take care of himself, because he's no good to his family if he's totally incapacitated from medical problems. So what I would say as that message to the world is sit down with your children, sit down with your spouse, and talk about your goals and your own health goals and your financial goals and your family goals and where you want to see your family go. And I think that a good medical practice intertwined with those goals is critical to your success. Whether it's Precision Medical or any other clinic that you go to, as long as the doctors care about you, they're committed, they want to help you, then it's up to you. And then the reality is you need to get serious about it, and because you only have one life. Mm-hmm. And as I tell patients all the time as well, there's a lot worse things than dying. And having a serious stroke and being incapacitated and not being able to do the things that you did before, and then also becoming a major financial burden to your family. Most of the time, those things are absolutely preventable. And if you just get serious about your health and need guidance on where to go to improve your health, that's when you need to communicate with your doctor and sit down as a team with your doctor and yourself and really come with a plan that helps you to push yourself to optimization. Because that's what we try to do, is we want to optimize people to be the best that they can be. But it has to start with them. And I think just having more dialogue with each other and having a desire to improve is the first step. So I would say that would be my message to the world is, take a good look at yourself, take a look at your habits, take a good look at your family, and come with some real introspective questions for yourself, and then go bring that to your clinician and work together with them to achieve your goals.
Beautiful. I love it. Before I close it and I tell you thank you for the incredible things that you said today, I have actually a present for you. Oh. So this is a gadget that we give to everybody that comes to my podcast.
Okay.
It's something that I 3D print, and is a memory that you've been here to this podcast. I'm gonna put a date and my signature, and you can sign it as well. And so you can put it in
Awesome.
your desk or somewhere. They
Yeah.
will remember you the time that you've been here
That's super
as a
cool.
guest. And so before, different colors. But
Leo saves the world. I
Yeah.
love that message.
one podcast per time.
Yeah, that's
And
awesome.
I'm doing nothing actually, because my guests are the one that they do all the work, because they use their words to help us. And so thank you so much.
Well, thank you very much.
If
That's
you
really
wanna
cool.
Sign it.
Thank you very
Beautiful.
much.
And now this is yours. I hope you can put it, I don't know, in your desk.
That's
or,
going on my desk.
Yeah, wherever you want to put it. And we'll remind you, this podcast that you did with us. And so thank you so much, Barry, for the words that help us so much in a topic that is so important. And I'm gonna put also your information down the channel everywhere, and I hope that this can really start something, because it's very important that we change and we don't go in the wrong direction that sometimes we feels like it. So thank you so much for all the advices, and I hope that we can do a revolution for a better life, all of us.
Thank you, Leo.
Yeah.
I appreciate it. It's good
Thank
to
you
be
so
here.
much.
All right.
Bye, guys.
Goodbye.